So now I'm going to check for pedal pulses. Pedal pulses. Dorsal pedis pulses, I'm sorry. And they're both equal bilaterally and 2+ strength. And I'm going to check on these little toes, which are all healthy appearing nails, pink, flat, and the capillary refill rate is about less than 2 seconds on each one. Okay, we're going to do one more test here. If you will, push against my hand at the same time as hard as you can. Perfect. And that was a 5 strength result. Okay, you please can stand up. Okay, I'm going to.
So I'll need you to scoot back a little more. I'll hold this table paper. Okay, so the first thing that you need to know is that I'm going to dorsiflex your foot, and if you feel any pain in the popliteal region, which is behind the knee, then just let me know, okay? Okay. And this might be a little ticklish to your feet. I'll try to get it done as soon as I can. Any pain?
No, ma'am. No, ma'am.
Okay, so you have a negative Homan sign bilaterally. Okay, and if you will, you can sit back up. I'm going to assess for skin turgor, so it'll give
And check for her leg. So at this time, I'm going to note the color as well. Same thing, light beige, pink undertones, a little more redness around here. I do notice bunch of freckles everywhere, which are primary lesions. I see that you have a scar, possibly from a past surgery. Is that correct?
Yes.
Okay. Patient has a secondary lesion of a incision scar on her knee. I'm going to check. Just let me know if you feel any pain at all while I'm palpating.
Okay.
Any pain at all?
Nope.
Okay. I'm going to be checking underneath. Skin looks even, feels warm and dry. No apparent wounds or openings. It does get a little colder down to the toes, which is to be expected. I'm checking for heels, nothing open. In between her toes, everything looks well groomed. Her nails look to be expected findings. They're nice and clean. Looking at her hair follicles, they are, I believe the patient shaves her legs, but they are even. Okay, that all looks good. Now I'm going to be checking for the dorsalis pedis. Then lastly, I'll just make sure the patient is comfortable. While she's laying there, I would check to see if I see any other interventions, like if she had a Foley, if she has an IV, which we say that she doesn't. The patient is on room air, so no oxygen. Any other devices like that. Make sure that the bed is at lowest position, your items and call light are in reach, side rails are up. Anything else I can do for you?
No, I'm all good.
Okay. Okay. And your socks. Possible space. Will you lay down for the apical for me? I'll have to move your breast out of the way a little bit. So now I'm going to get you to lay down. And if you can lift your chin up for me just a second. Okay, I do not see any DVT noted. Okay. So now I'm just going to listen to your abdomen, okay? I'm just going to lift this up. And I'll try to cover you as much as possible. Okay, +2 equals bilaterally. Now I'm going to come down here and feel your posterior tibial. And then +2 equals bilaterally. Now your feet, they are warm to touch. I don't see any edema. You haven't had any pain in your legs or anything like that? No. Okay. Hair is adequate growth. No edema is present. Skin's warm to touch. Color is good for ethnicity and race. Your cap refill is less than 3 seconds, which is good. I'm just gonna have you bend your knee in, okay? Okay. side. Okay. I don't hear any crepitus. Can you roll your ankles for me? Okay, good. I don't hear any crepitus with that either. So you have full range of motion in your upper and lower extremities. Okay, so I'm going to go ahead and have you sit up for me.
All right. I'm going to check now at the bottom of your feet.
Okay.
I'm going to check your skin temperature on your legs first.
Yes, ma'am.
That feels good, warm. And I'm going to check your pedal pulses.
Okay.
So. Okay. Check your cap refill.
Okay.
All right. Now I want you to push against my feet, hands.
Mhm.
All right. Now pull.
Okay.
Great. You can go ahead and sit up for me if you would like.
And then same thing with the arms. Have you had any limitations in range of motion, weakness within the muscles, changes in sensation, any pain within the legs?
No.
Okay, good. I'm gonna go ahead and check cap refill on the bottom here since you have polish on. Alrighty, cap refill is less than 3, so that is good.
With your arms relaxed on the side. Okay. Are you comfortable? Okay. Is it okay if I lift up your shirt? Yes. Okay. So looking at the skin of the abdomen, it is flat and symmetrical. The skin is pink, warm, smooth, and dry. With your legs. So looking at the patient's legs, there is no edema or varicosities present. Legs are shaven. I'm going to go ahead and test her cap refill on both feet. Cap refill is less than 30 seconds. And toenails are clean and well kept. Now I'm going to do the same thing that we did with your ankles, shoulders, and elbows. Some strength exercises and range of motion exercises. So can you just push against feet? And then push against my hands, and then I'm gonna have you lift up one side, thank you, and do the same thing to the other side. Perfect. Now, just like your wrist, I would like you to rotate your ankles for me. Okay, perfect, thank you. So full range of motions, or sorry, I apologize. So now I would like you to, so I had assessed the muscle strength of the lower extremities. They're strong, equal, and bilateral. I had her rotate her ankles for full range of motion. Now I'm gonna have her lift up her knee and push off to the side, and then pull back down, and do the same thing to the other side, and pull. As well. I'm gonna have you take off your shoes and socks for me, please. Both of them? Yep, both of them. Okay, and I'm going to go ahead and feel the posterior tibialis pulses. Two plus bilaterally. And her pedial pulses are 2 plus bilaterally. Can you wiggle your toes for me? Good. Go ahead and point your feet down. Good, and now point them up. Good, and then can you bring your feet in? Now out. Good. So she has good, she has active full range of motion of her feet and ankles.
So make sure that it's bent so that she can feel it. Okay, so let me know where you feel it.
On my big toe.
Okay, right or left?
Side. Right side.
Okay.
You can feel it. You can feel it. You can feel it. You can feel it.
Okay, good job. Okay, we're doing the same thing on here. Okay, let me know where it is.
On my big toe on the left foot.
Okay, can you feel it?
I can feel it. I can feel it. I can feel it. I can feel it.
Okay, so the sensation on the bilateral foot is normal, and you go in, and then internal rotation. Okay, one more time, external rotation. Okay, so I didn't feel any crepitus. Taking for range of motion, can you like rotate here? Yeah, there, and then your toes, curl it up, out, movement. Okay, against my hand, both sides against my hand, pressing here. Okay, so that's good. Okay, you can go ahead and sit down. With the toes and the foot, I don't see any swellings, any redness, or any abdominal mass or growth. I'm palpating. Okay, again, no, nothing I can feel, no tenderness, no abdominal mass or growth, so that's normal.
I'm gonna have you just lean back. We would check the femoral pulses and the popliteal pulses. Now we're gonna check some breath sounds and muscle strength. Just push against my feet, your hands, and then pull back. Perfect. Check capillary refill.
Okay, next we're gonna move on to your abdomen. Can you go ahead and lay back for me? And again, I would do all of this abdomen assessment with her shirt up, but for this assignment, we are going to do it over her shirt. So upon inspection, I noticed that her skin color is consistent with the rest of her body. No obvious distension, lesions or trauma, no pulsation, so that's good, and her umbilicus is midline with her, as noted. Next, I'm going to move on to her lower extremities. So for this, I'm going to go ahead and check your skin. So again, she has hairs evenly distributed on her skin. Can you go ahead and point your toes? Okay, and flex. Perfect. So her range of motion in her feet is 5+, excuse me, which is good. It's an expected finding. Okay, so that concludes my assessment.
Okay, all right. And I'm gonna have to take off your shoes briefly. All right, I'm gonna be checking your dorsalis pedis pulses. They're 2+ equal bilaterally. Your posterior tibial. 2+ equal bilaterally. Now I'm going to check your cap refills. They are less than 3 seconds, so your circulation with your lower extremities is intact. Also, your skin is warm and dry. I'm going to be checking your Babinski reflex right now. All right, it is negative, which is good for your age. Now I'm going to have you bend your knee. Okay, and then lift it for me so I can check your hip joint. Any pain or tenderness with that? No. All right, I'll be doing the same on this side. And then lift your, all right, any pain or tenderness? No. All right, I did not hear or feel any toughness on that side as well. All right, and then if you could push against my hands. And then push against, also equal bilaterally. Now I'm gonna have you sit on the side.